class about diagnostic method for different clinical form of leishmaniasis. As I mentioned before, we have different clinical forms of leishmaniasis. We have at least three clinical forms: cutaneous leishmaniasis, visceral leishmaniasis, and mucocutaneous leishmaniasis. As I mentioned before, cutaneous leishmaniasis is divided to different subgroups: zoonotic form produced by Leishmania major, and rodents. These rodents are reservoir host of the disease. And the second form is anthropomorphic cutaneous leishmaniasis, produced by Leishmania tropica, and infected human are the reservoir host of the disease. And the third group, diffuse cutaneous leishmaniasis, caused by Leishmania aethiopica, and principal reservoir host of the disease is hyrax, animal similar to rabbits, and lives in Ethiopia. And the fourth group is locoid or recidivant form, similar to leprosy, and produced by Leishmania tropica and sometimes Leishmania major, and very similar to skin tuberculosis or locoid form of leishmaniasis. The diagnosis of this form is very difficult, and the last form of cutaneous leishmaniasis is PKDL, post-callosal dermal leishmaniasis, a skin lesion after visceral leishmaniasis. And visceral leishmaniasis is fatal form of leishmaniasis, disseminated in the internal organs such as liver, spleen, lymph node, and so on. And we have four groups of visceral leishmaniasis. Indian visceral leishmaniasis caused by Leishmania donovan, and infected human are reservoir host of the disease. And the other form is African trypanosomiasis, caused by Leishmania donovani or Leishmania aretivani. This is anthropomorphic form, and infected human are reservoir host of the disease. These are anthropomorphic form, Indian and African. And other form is American visceral leishmaniasis, caused by Leishmania shagassi, distributed in American continent. And Lutzomia is principal vector of the disease. And canines are reservoir host. Domestic dog, fox, reservoir host of this form. And the last form is Mediterranean visceral leishmaniasis, distributed in Middle East countries and south of Europe, and produced by Leishmania infantum. And the principal reservoir host of this form are canines, such as domestic dogs, jackals, foxes, wolves, are reservoir host. So, American visceral leishmaniasis and Mediterranean visceral leishmaniasis are zoonotic form. And Indian and African visceral leishmaniasis are anthropomorphic form of the disease. And the last form is mucocutaneous leishmaniasis, distributed in mucosal membrane of the body, especially in nose cavity, in nose, in pharynx, disseminated and produced by Leishmania brasiliensis. The principal agent of this form is zoonotic. Rodents, horse, dogs are reservoir host is zoonotic form, and Lutzomia species are main vector of this form. These different clinical and epidemiological form of leishmaniasis I mentioned in before. And it's a slightly different clinical form of leishmaniasis with different lesions and disease. For the diagnosis of leishmaniasis, visceral, mucocutaneous, and cutaneous leishmaniasis, we have different laboratory methods for the diagnosis of the disease. These methods, the first is parasitological methods. The second is immunological methods. And the third method is molecular methods. And some non-specific method because very simple. But before we use from laboratory method, we consider to history and pathognomonic signs. Very, very important. History. History is very, very important and near to diagnosis of leishmaniasis. In history, such as living place and history to travel to endemic area during last year is very important. We have different endemic region is endemic for cutaneous leishmaniasis or endemic for visceral leishmaniasis. For example, a patient shows a history to northwest of Iran. Northwest of Iran is endemic area for visceral leishmaniasis. And other subject is pathognomonic clinical sign is very important. For example, a children with dromedary fever and hepatosplenomegaly and history to endemic areas of visceral leishmaniasis is very, very important and near to visceral leishmaniasis. Or a skin lesion lasts over 2 weeks in endemic areas, maybe cutaneous leishmaniasis in endemic area. So, before we use from laboratory methods, we consider to history and pathognomonic clinical signs. It's very, very important for physicians and for diagnosis of leishmaniasis. The first laboratory methods which are used for the diagnosis of leishmaniasis are parasitological methods. Parasitological methods are gold standard for the diagnosis of all clinical cutaneous, visceral leishmaniasis, mucosal leishmaniasis, mucocutaneous leishmaniasis is gold standard because we can see the agent, the principal agent under microscope is gold standard. Parasitological methods are divided to 3 groups. The first is direct exam or microscopy. Microscopy or direct exam, the first stage of parasitological methods. The second method is culture. We can culture all species of leishmania in culture media. And the third form is animal inoculation. We have some susceptible animals for each species of leishmania. We can use from this method for the diagnosis of leishmaniasis. So, the first stage of laboratory diagnosis of all clinical form of leishmanian disease is parasitological method. The first parasitological method is microscopy or direct exam. We have three key points for parasitological methods. Very, very important. The first is good sampling. Good sampling. The second is appropriate staining and processing. And the third is careful demonstration. These are three key points for the parasitological methods. For parasitological method as gold standard, the first is microscopy, and the first is good sampling. Good sampling is very important. A patient with ulcer, with a skin lesion, a person or a patient with a skin lesion, we can prepare samples around the lesion, not central the lesion, the around the lesion. As you see in this slide, we can prepare sample from suspected cutaneous leishmaniasis patient. We prepare sample around the lesion, not the central lesion, because the around the lesion, the number of MST4 is very high, and we can prepare the sample around the lesion. We use from a sharp tip instrument. For example, use from scalpel, use from lancet. A sharp tip of instrument we can help us for prepare the sample. Its name is vaccine-based instrument with a sharp tip, and penetrate around the lesion and prepare the fluid, the serosity fluid material, and prepare a thin microscopical slide. A thin microscopical slide. This is very important. Prepare sample. And then we fix the microscopical slide by methanol, absolute methanol. From 1 minute, enough. And then stain by GIMSA. GIMSA is an appropriate staining for all parasitic agent in the peripheral blood. GIMSA staining. GIMSA is an appropriate staining for all blood parasites, malaria, filaria, leishmania, trypanosoma. It's very, very good staining. So, we prepare a microscopical slide, fixed by method, 1 minute, and then stain by GIMSA for 20 to 30 minutes. And we can see a mastigot under light microscope with high magnification. And we can see the MSD4. As you see in MSD4, we have a macrophage, and these are MSD4 of Leishmania after staining by gypsum. So the first stage for the diagnosis of leishmaniasis is microscopical examination or parasitological examination for skin lesion. But a patient with suspected to visceral leishmaniasis, not cutaneous leishmaniasis, we can prepare sample from a spleen. The sensitivity rate of a spleen is very high. We can see the MSD4 between 92 to 98% high sensitivity rate in patient. But spleen aspiration is very dangerous because with hemorrhagic. And the alternative procedure for the diagnosis of visceral leishmaniasis is bone marrow aspiration. We can use from bone marrow from sternum or iliac. We can use from small amount of bone marrow and prepare a microscopical slide and fix by methanol and stain by gypsum. And we can see MSD4 under light microscope with high magnification. You can see the MSD4 in laboratory afternoon in practical class. So the first procedure for the diagnosis of cutaneous and visceral and mucosal form of leishmaniasis, the first stage is parasitological method, and first stage of parasitological method is microscopy. We can use from microscopy for demonstration of MSD4. The sensitivity rate of microscopy is about 70%. And all patients and on diagnosis by microscopy we can use from other procedures. The second procedure is culture. We can use from culture media for cultivation of all species of Leishmania. And bone marrow aspiration in Imam Khomeini Tehran infection department, and the patient suspected to visceral leishmaniasis, and we can see different macrophages of infected macrophages containing MSD4. And the second stage is culture media. At this time, we have at least 20 culture media for cultivation of Leishmania parasite. But the cheap and simple and oldest culture media is 3N, an old and specific and simple and cheap culture media for cultivation of Leishmania species. This is very old, prepared in 1908, more than 1 century ago, and a simple culture media we use from fluid material and inoculated in culture media. After 1 or 2 weeks, we can see poromastigote form of leishmania, not amastigote form. Poromastigote form of leishmania in culture media. As you see in this slide, this is 3N culture media. 2 key points for culture media is very, very important. The first is culture to aseptic condition. No culture media infected to bacteria or fungi. It's aseptic form. Around the flame. And the second key point is leishmania parasite needs to 18 to 26 degree centigrade Celsius. All leishmania can grow and culture in 18 to 26 Celsius, not 37 Celsius. 37 Celsius used for bacteria. For leishmania, 18 to 26 Celsius. These are 2 key points: aseptic condition and appropriate temperature. It's very, very important culture of leishmania. In culture media, we can see the poromastigote form or leptomonal form, not amastigote form. After 1 to 2 weeks, we can see the poromastigote form is unstaining. You see in a practical class a drop of culture media under light microscope, you see many poromastigote form. These are poromastigote form. And you can stain the poromastigote form by Giemsa. As you see in this slide, this poromastigote form is stained by Giemsa. As I mentioned in last class, spinal form, central nucleus, anterior kinetoplast, and free flagella. These are poromastigote form. So, the first stage for the diagnosis of leishmaniasis is parasitological methods. Parasitological method is divided to microscopy, and then culture, and then animal inoculation. In culture, sometimes we can culture amastigote form, but very difficult. So for the diagnosis, we can from poromastigote culturing, not amastigote culturing. Amastigote culture used for to determine of susceptibility of anti-leishmania drugs, not diagnosis, because very difficult. And we have some susceptible animals for against the leishmania parasite. For example, the susceptible animals for leishmania major is small white mice used for physiology, pharmacology, very susceptible to leishmania major. We can use from these mice and inoculate a fluid the base of tail of the mice and appear lesion after 2 or 3 weeks, and we can demonstrate the lesion, and we can isolate the Leishmania major. So, Suri or small white mice, or other name is bulbs mice, very susceptible to Leishmania major and resistant to Leishmania tropica. A patient infected to Leishmania tropica, inoculated to the mice, no lesion appear. But the lesion produced by Leishmania major produce lesion in mice. And differentiation between Leishmania tropica and Leishmania major. And golden hamster and dog very susceptible to Leishmania infanto. Produce Leishmania visceral leishmaniasis or Leishmania infanto. As you see in this slide, we inoculate the material fluid from a CL patient and inoculated the base of tail of the mice and produce a lesion after 2 or 3 weeks. And the golden hamster inoculated by suspension from spleen or bone marrow aspiration from a patient and inoculated intraperitoneally in these mice and disinfected to visceral leishmaniasis with the hepatosplenomegaly and other clinical form. And you can see the emaciated form in the macrophage. So, the first procedure is parasitology. Parasitological method are divided to 3 groups: microscopy, culture, animal inoculation. And the second procedure for laboratory diagnosis of leishmaniasis is immunodiagnosis. Immunodiagnosis. As you know, we have 2 immunological mechanisms. The first is natural immunity, the second is acquired immunity. We have 2 immunological mechanisms. We can use from acquired immunity for the diagnosis. Acquired immunity is divided to 2 sections. Cellular immunity, cell-mediated immunity, lymphocyte T, lymphocyte B, cellular. And the second is humoral immunity. We can use from cellular immunity, cell-mediated immunity, or humoral immunity for the diagnosis of leishmaniasis. In cellular immunity, we have a useful test. Its name is LST, Leishman skin test, LST. For cellular immunity, cell-mediated immunity, LST, Leishmani skin test, LST. Other name, synonym of LST is Montenegro test. Montenegro test or LST is a specific skin test for the diagnosis of leishmaniasis. A skin test for the diagnosis of tuberculosis. What is the name? The skin test for tuberculosis. tuberculin test or Mantoux test used from PPD. For diphtheria, sheep test. For hepatitis, Casimir test. For trichinosis, Bachmann test. Other name of test. The test used for the diagnosis of leishmaniasis name is Montenegro test or LST, Leishmanian skin test. In this test, we use from 0.1 milliliter of leishmanian antigen intradermal in 4 hours. 0.1 milliliter of leishmanian antigen produced by Pasteur Institute, produced by Wellcome Company, injected in intradermal in 4 hours. After 48 to 72 hours, similar to tuberculosis. After 48 to 72 hours, the reaction or induration, sickness, name is induration, measured by a roller or colis. The sickness is induration. If average diameters from 5 millimeters and above, consider positive reaction. Under 5 millimeters, consider negative. Different in different infection diseases. For example, in tuberculosis, consider 10 millimeters and above, positive. 5 to 9 suspected. But in leishmania or leishmaniasis, consider 5 millimeters and above, consider G positive. Under 5 millimeters, we use from LSD for the diagnosis of leishmaniasis. As you see in this slide, this is leishmania produced by Pasteur Institute of Iran under the WHO. It's controlled. And the procedure of the test 101 point millimeter intradermal in 4 hours and reaction from 48 to 72 hours. And 5 millimeter and higher, consider positive. And this is positive reaction. As you see, is average diameter. For example, 6 diameter, and this is 4 diameter. 6 plus 4, 10 divided to 2, 5. 5 millimeters and above, positive. This is positive reaction. This is a very positive reaction, and this is a negative reaction. We can use from LSD for the diagnosis of mucosal form, mucocutaneous form, and locoid form of leishmaniasis. We can use from LSD for the diagnosis of locoid form, I mentioned before, locoid, and mucosal and mucocutaneous leishmaniasis. We don't use from LSD for the diagnosis of visceral leishmaniasis. Because in visceral leishmaniasis, the cell-mediated immunity is suppressed and no reaction to leishmania antigen. So we cannot use from LSD for the diagnosis of visceral leishmaniasis. We can use from this test for the diagnosis of mucosal, mucocutaneous, and locoid form of leishmaniasis. We can use this is locoid form. This is locoid form. This is locoid form. Different. This is mucosal form. The patient in Iran, south of Iran. We can use from this test. And the other procedure of immunodiagnosis is antibody detection or antigen detection. Name is humoral reaction. We can use from this test for the diagnosis of leishmaniasis. The name of this test is serological test. Serological test. We can measure the antibody against leishmania. We can find the antigen of leishmania in blood, in serum, in urine, in different forms. This serological test. We can use from serological test for the diagnosis of visceral leishmaniasis and mucocutaneous leishmaniasis. We can use from serological test for the diagnosis of visceral because the antibody concentration in visceral leishmaniasis is very high and in mucosa. And we cannot use from serological test for the diagnosis of cutaneous leishmaniasis because the antibody in cutaneous leishmaniasis is very high. The concentration of antibody is very low. We can use from different serological methods and use from 1 drop or 2 drops of blood is enough. 1 or 2 drops. Use from lancet, from a finger to, we can use from filter paper for preparation of this blood and transported to laboratory and diagnosis of the disease. For antibody detection, we can use from different serological tests. The oldest test is IFR, indirect fluorescence antibody test. IFR. We can use from diagnosis of different infection diseases, such as tuberculosis, typhoid, and so on. We can use from visceral leishmaniasis and muco or mucocutaneous leishmaniasis. These are positive reaction, yellow reaction, and this is negative reaction under fluorescence microscope. And other tests we can use from the diagnosis of visceral leishmaniasis. This is ELISA. Enzyme-linked immunosorbent assay. Very sensitive serological test. The positive reaction is yellow or brown. And the negative, no color. This is very sensitive test. We can use from detection of anti-leishmania antibody in the peripheral blood, in the serum. And other test is very appropriate test because this test does not need any equipment such as immunofluorescence microscope, such as ELISA reader, such as conjugate, such as substrate. It's very, very simple test. Name is direct agglutination test. Direct agglutination test, or DAT. With a plate, small amount of antigen, a sampler. Very simple test. We prepare this antigen in our laboratory in the School of Public Health, Tehran University of Sciences, Medical Sciences, and use from antigen in different parts of Iran, especially in endemic areas, and diagnoses the patient of visceral leishmaniasis and treated. So the mortality rate of visceral leishmaniasis in Iran reached under 2% because rapid detection and appropriate treatment is very, very important. The test is very simple. The reading of test is very simple, as you see. In positive reaction, we can agglutination or lattice the bottom of the plate. These are positive reaction. And in negative reaction, as you see in this slide, a blue dot the bottom of it. So these are negative, these are positive reaction. There's not any microscope, any equipment we can read with a naked eyes, and the reading is very simple and performance is very simple. This is validated test for the diagnosis of visceral leishmaniasis. In human and in animals, we can use from this test for the detection and diagnosis of canine visceral leishmaniasis. Visceral leishmaniasis in dogs, in rodents, in jackals, in fox. Simple test and other tests. These are positive reaction because of agglutination, and these are negative reaction. A blue dot precipitate the bottom of plate. Well, different antigen and different. And the last diagnostic method for antibody detection is rapid test or deep-stick ARCA39 test. Rapid test, the read of the test is from 2 minutes to 30 minutes because rapid test. We can read the result after 2 minutes to 30 minutes. In rapid test and early diagnosis. And in positive reaction, as you see in this slide, we can see 2 lines. This is a test line and this is a control line. But in negative form, we can only control line, not test line. We can use from this test especially in clinical form of visceral leishmaniasis. The sensitivity rate of this deep-sticks or rapid test from 60% to 98%. Related, the company produced this test. We can use from this test for the diagnosis of infected dogs. What is the result? One the result negative.
Negative.
The second
Negative.
negative. The third
Positive.
positive. Because the test line.
Test line.
And the fourth
Positive.
positive. So we can use from rapid test for the diagnosis of visceral leishmaniasis in human and in animal reservoir host. We have only serological tests. We can detect antigen, not antibody. The above mentioned serological test, we can detect antibody test, anti-leishmania antibody test. But we have only serological tests, we can detect antigen, not antibody. Name is Cotex test. We use from this test for the diagnosis of co-infection of visceral leishmaniasis with AIDS, HIV positive. Because in HIV positive or AIDS patient, the concentration of antibody is very, very low. So we can use from the Cotex test for antigen detection. Antigen detection, not antibody detection. This test is very simple. We can use from urine of the patient, not serum of patient, urine. And the positive, you see agglutination in card slide, agglutination. But these are negative. In negative, a milky solution, not agglutination. We can use from Cotex for the diagnosis of co-infection of visceral leishmaniasis and HIV or AIDS patient. This name is Cotex. So we can different diagnosis method. The first is parasitological method. The second is immunodiagnostic method. And the third method is molecular methods or PCR. PCR, a method for detection of DNA or RNA. In immunological method, we can detect antigen or antibody. But in molecular method, we can detect DNA or RNA. Why? PCR method. PCR method is a very sensitive method, and we can use from the diagnosis of different infection diseases such as viral diseases and bacteriological diseases, and we can use from this PCR in sometimes in some of parasitological diseases. We can use from PCR for Leishmania species identification. Leishmania species identification. For example, we can see a lesion and we must determine the Leishmania species. We can use from PCR. We can use from different primates, and we can use from the species of Leishmania. The species of Leishmania. We can use from a stained microscopical slide for the PCR diagnosis. This is a microscopical slide, stained by Gibson, and used from PCR for the Leishmania species identification. As you see, the lane first, the lane 1 is negative control. This still button, you see, you don't see any
Elimination.
pattern or lane, no lane in this. And the 2 is a standard, positive standard of Leishmania major. And the third positive standard of Leishmania tropical. And the fourth positive standard of Leishmania infant. And other unknown species with different patients. Please, what is the 5 sample for Leishmania species? Compare the lane and similar to lane 2. Lane 2, I mentioned before, Leishmania major, standard, positive standard. So 5 and 6 is similar to Leishmania
Major.
major. So the principal agent of this patient are Leishmania major. What is the species of lane sample 7?
Leishmania tropic.
Leishmania tropica, because this is a standard of Leishmania tropica. It's similar of Leishmania tropica. So 7 is Leishmania tropica. And 8 and 9, Leishmania implantum, because the lane is similar to 4. 4 is positive Leishmania implantum. So we can use from PCR method for the diagnosis and for Leishmania species identification. Because the treatment and duration of treatment in different Leishmania is different. So this is summarized of the analytical methods. In cutaneous leishmaniasis, we can use from parasitological method, microscopy, culture, animal immunization. In immunodiagnosis, we can use from LSD, not serological methods, for cutaneous leishmaniasis, because the anti-Leishmania antibody concentration is very low. And use from molecular methods for the diagnosis of complicated cutaneous leishmaniasis, such as low-point form of leishmaniasis, for species of Leishmania identification. We can use from PCR methods. And in suspected visceral leishmaniasis, we can use from parasitological methods, microscopy, aspiration from bone marrow aspiration, culture, and sometimes animal inoculation. And immunodiagnosis we can use from serological method, not LSD, because LSD is negative. Serological method, IFR, ELISA, DAT, D-testing, and we can use from PCR for Leishmania species identification. After diagnosis of leishmaniasis, we can treat the patient. For the treatment of leishmaniasis, we can use from some different procedures. The first procedure is physical treatment. Physical treatment used only for treatment of cutaneous leishmaniasis. We have two methods of physical treatment of cutaneous leishmaniasis. The first method is cryotherapy. Produced from a liquid nitrogen and freeze the lesion. We must freeze the lesion by liquid nitrogen. Liquid nitrogen freeze and produce 196 degrees centigrade minus 196 degrees centigrade freeze the lesion. So we use for the treatment of some form of cutaneous leishmaniasis. And for thermotherapy, we can use from temperature, high temperature. The contrary of freeze cryotherapy, we can use for high temperature, use from laser and produce about 70 or 80 degrees centigrade. Name is thermotherapy. We can use from cryotherapy and thermotherapy for the treatment of cutaneous, only cutaneous leishmaniasis. The cure rate of cryotherapy and thermotherapy is about 70%. What other treatment procedure is chemotherapy? Chemotherapy. The first line drug for the treatment of all clinical form of leishmaniasis is antimonial compounds. Antimonial compounds. Antimonial compounds. The first line drug for the treatment of all clinical form of leishmaniasis is antimonial compound. We have two groups of antimonial compounds. The first is 3 valent antimonial compounds. And the second is pentavalent antimonial compound with two group of drugs. 3 compounds, antimonial compounds, and 5 antimonial. 3 antimonial compounds are very toxic, such as codeine and different drugs, very toxic. And we use from pentavalent antimonial compounds, low toxicity. We have 2 drugs of pentavalent antimonial compound. The first drug is, the name is meglomine antimoniate. The trade name of meglomine antimoniate is glucantin. And the second drug is sodium stibogluconate. The trade name is pentostan. So we have 2 specific anti-leishmania drugs for primary line. The first line of treatment of leishmaniasis is pentavalent antimonial. We have 2 drugs of pentavalent antimonials, glucantin and pentostan. The dosage of this drug is from 20 antimonial pentavalent antimony per kilogram daily. We calculate the 20 pentavalent antimony per kg daily in ZCl zoonotic leishmaniasis for 2 weeks. In ACL for 3 weeks. In VL for 4 weeks, 28 days. For PKDL for 6 months, daily. So, the first line of drug, pentavalent antimony. Different dosage in different clinical form. ZCL for 2 weeks, ACL for 3 weeks, VL for 4 weeks, and PKDL for 6 months. These drugs is cardiotoxic and nephrotoxic. And we can use only for injecting, for injection, not oral.
Cutaneous injection.
Only injection, IM or IV injection. What is first drug? The patient no reaction and no response to this glucosamine or pentostan, we can use from alternative drugs. We have 2 alternative drugs. The first is amphotericin B, amphotericin B, only IV injection, and this drug is nephrotoxic and an antibiotic for the treatment of visceral fungi. And we can use from amphotericin B in the patient no response to glucosamine or pentostan, we can use from amphotericin B. The new drugs and alternative drugs is miltefosine. This is oral drug and new drugs. We have 10 milligram or 50 milligram capsules. Name is miltefosine. This is new drug.
It's new drug.
And have anti-leishmania activity, and we can orally 2.5 milligram per kilogram for 4 weeks. Very effective on cutaneous leishmaniasis and visceral leishmaniasis, especially in the leishmaniasis not responsive to other drugs. We can use from these drug. But this drug is very, very expensive.
Oral.
Very expensive. Miltefosine.
Oral or injection.
Oral.
Oral.
Only oral. Miltefosine only oral. But these drug, amphotericin B and glucosamine and pentostan, only injection. IM or IV injection. These are alternative drugs. As you see in this slide, we use from miltefosine for the treatment of complicated cutaneous leishmaniasis in north part of Iran, it's supported by WHO. And you see, before treatment by miltefosine, after treatment of miltefosine. And we can use from miltefosine for the treatment of complicated visceral leishmaniasis in children with high responses. With very
It need 4 week to treatment. Need 4 week to treatment.
yes. And this is mucosal form of leishmaniasis. No responses to glucan. We treated by miltefosine. Before treatment, mucosal form. And after treatment. It's very drug of choice for the treatment of leishmaniasis. And in Iran, produced local gel or topical
Yes.
topical. Name is enfoliage. We can use from enfoliage, but the cure rate of this form is about 60%. No high percent. We can use in a small lesion from enfoliage. Used for at least for 2 weeks. And for control of leishmaniasis, we can use from different procedures. The first procedure is vector control and disconnect the life cycle using from insecticide materials and reservoir destruction. For example, destruction the reservoir house in ZCL reservoir house of desert rodents and in visceral leishmaniasis, the principal reservoir house are canines. Treatment of canines and destruction of infected canines very helpful for the control of the disease. Passive and active case detection is very important and help to lower the mortality rate of visceral leishmaniasis. Individual protection very important from bed net, impregnated bed net, public health education, and environmental sanitation is very important for the control of leishmaniasis. We have a unique method for the control of chikungunya leishmaniasis. Name is leishmanization. Leishmanization. Leishmanization, an effective procedure for the control of chikungunya leishmaniasis in Iran, Iraq war. Used from horomastigote, alive horomastigote of Leishmania major, culture in the culture media, and inoculated from 300,000 of active horomastigote of Leishmania major behind the deltoid muscle and produce a small lesion and heal and protective against chikungunya leishmaniasis caused by Leishmania major, caused by Leishmania tropica, and protection is very high. About 90% of inoculated protect against chikungunya leishmaniasis. We can use from this method, and after the end of Iran-Iraq war, this method discontinued by WHO, and research on killed vaccine against leishmania, but at this time we don't have any killed vaccine or any effective vaccine against leishmaniasis. And this is leishmanization. The name is leishmanization. So you can have it 10 minutes and continue this class about trypanosoma. About 20 minutes. African and American trypanosoma.
Okay.
And you have a break.
Thank you. Thank you.